get started. Welcome, everyone. This is part 5 of YANA's programs on careers in social impact. Tonight, we're going to be exploring this traditional understanding of the term burnout, which I understand, and I'm not a sociologist or a psychologist, was introduced in a 1974 journal article by psychologist Herbert Freudenberger, has had what I understand to be a broader definition used now in the general lexicon, just people being overburdened with work. But we're really talking about the very real mental health issues and tolls of those and for those who work in the social impact sector and in direct services and the people who support and manage them. So we have with us tonight 4 extraordinary Yale-educated women, and some of whom are still being educated, who are addressing mental health from a variety of positions. We have someone who's a people manager at a nonprofit, a nurse practitioner, 2 mental health focused nonprofit founders, 1 for educators and the other one for community organizations. So I'll just do a quick intro to welcome our panelists, and then we're going to jump into some questions. So we have with us Allison Hertz. You want to just raise your hand, Allison? Class of 05. She is the Senior Director of People Experience at City Year. And she is working to counteract the stigma associated with depression, anxiety, and other kinds of mental illnesses through a new organizational strategy focused on intentionally supporting mental health and well-being of the entire City Year community for thousands of AmeriCorps members who support student success to the staff who show up for them. We have Sylvia Kimball Perry, who was a fellow classmate in my class of 91 from Yale, is a nurse practitioner affiliated with Mass General up in Boston. And she spent almost a decade figuring out what kind of healthcare career she wanted to specialize in. And luckily for us and the people she cares for the last 20 years, Sylvia has been working as a nurse practitioner in oncology and primary care at Mass General. She's held research and leadership roles and is working on other advanced degrees, just a tremendous amount of experience. We also welcome Nicola Fleischer, who is a current student, current student at SOM, class of 22. She is the co-founder of a new organization, edwell, which is a nonprofit wellness coaching platform for educators by educators, and that has a vision for healthier, happier school communities. And then we also have Daisy Rosales, SOM class of 20, recent graduate, who is also a co-founder of another nonprofit and the executive director of an organization called Brio, which enables access to contextualized mental health support through design and collaboration with local community organizations. Welcome, everyone. Thank you so much for sharing your time and your expertise with us. So we decided we were going to jump in and go right to questions for each particular panelist. And then we'll do some general questions. So I want to start with Sylvia, since we're the oldest ones on the panel. You've had the longest career here in the panels. Curious to know, tell us a little bit about how you've seen the issues of mental health, how they've changed, if at all, over the past few decades that you've been practiced, kind of in both the patients you care for, the staff you manage, and maybe the field that you are representing, nurse practitioners or similar.
So when I started, I was still using paper records and dictating notes that were then typed by someone else and put into a paper record. And I would start with saying, you know, the biggest change in my practice career has been the electronic medical record, which has been wonderful in many ways because it sort of streamlines and makes central all of your health information. But particularly sort of in the past, for me, at least at Mass General, the past 5 years, where it's really become central to our practice and central to you as patients being able to contact us and see your record. And it is a huge administrative task above and beyond just taking care of patients and seeing patients in exam rooms one after the other on a day-to-day basis. So in terms of mental health, I think when I started, it was clear that the patients in the hospital were the most sick patients, and to the extent that we could keep patients in an outpatient setting and deliver care as much as we could outpatient, the technology knowledge and the level of acuity, which means the level of complexity of a patient that's either in the bed, if you're an inpatient provider, or in front of you in your outpatient clinic, is just much higher. And I think with that comes a necessity to be up on all the technology. What are these medicines? What are these machines? I had a patient today who has a new pacemaker that gets checked daily by the electrophysiology group. And she was marveling at the technology that, you know, for her is this lump on her chest that is being analyzed on a regular basis. So technology, electronic medical record, and the need to stay up with that technology, I think, has raised the need to just be up on things all the time, be checking your communications, whether it's checking into the electronic record or checking your email and understanding whatever the updates are. So I would say that over my period of time has been something that's evolved. In terms of patients, the flip side of that electronic medical record and just the internet being everywhere is that you as a patient now have access to Google and all sorts of sources, many of which are great, many of which are not so great. And patients come into visits with a lot of knowledge and questions, and which is, you know, I think as a provider, I like to engage with people who've done their homework, but at the same time, sometimes that raises people's anxiety and they focus on a particular article or a particular piece of information they found. And that you can sort of get into a rabbit hole with trying to set them straight or quell their anxiety about what they might have read. And then I think the pink elephant in the room is COVID. That's changed everything. That's completely blown everything out of the water for all healthcare professionals. And you know, if you go back to March, April, May of 2020, the anxiety, the illness, exposure, the fear of bringing COVID home to our families when we were working in acute care settings, and now how work has changed, and we're still masked all the time. I'm still, you know, routinely kind of checking people's COVID status as they come in, or may not be allowed to come in because they've had an exposure. There's sort of an ongoing tail end of what was a very acute situation. So that certainly has changed the mental health landscape of health practitioners.
Sorry, it sounds like there's been kind of a slow increase of anxiety maybe and stress related to some of these new technologies and the ability to deliver more services, more complicated services, people finding more information. And then we've got the sort of compressing nature of COVID, this whole other, that's not really going away. And for those of us who maybe only go into a medical facility occasionally, you and other healthcare providers are dealing with this constantly, day in and day out. So we want to get into a little bit more about like how is that handling, how are the providers doing, to you about others. But thank you for sharing that initial part of the story. Allison, I'd love to turn to you. You've been pushing to develop what I understand, a new mental health program at an organization that's been around for several decades. That is in the business of placing school and college graduates into success coach roles in public schools around the country, if I got that right. So I'm just curious, you know, what has been happening in that space and in your role from where you sit at City, or that kind of drove you to focus on this need to establish some kind of internal program, and how is that going, and what kind of drove you to do that?
Yeah, thanks, Rachel, and great to be with everyone today. So City Year, it has been around, as Rachel said, for a long time, since 1988, and we are definitely on a learning journey and growing in our understanding of how important both expressing care and taking care of ourselves as well as our community, including our thousands of AmeriCorps members and then the staff members who support them. So we've been learning a lot about how important caring for our people is to our work with students in schools. And in terms of our entry point into the mental health space, we learned and observed a few years ago that mental health was one of the leading reasons that our AmeriCorps members were voluntarily leaving the service program early. And the very initial kind of reactive response was to put in place some new benefits, new mental health benefits such as Talkspace. However, there was also a really intentional effort made by some of our organization's leaders to take a step back in order to gather a deeper understanding of what the kind of underlying factors were that were shaping the mental health and well-being experiences of our core members. So we could then develop just some really intentional kind of solutions for supporting them while they navigate a rewarding but a very challenging service experience. And, we also have been continuing to just kind of learn more about how caring for one's mental health while supporting students is just so fundamental to like an adult's ability to build healthy relationships with students. And our AmeriCorps members are in the business of building like relationships, and that is the way in which they really show up for students, student success. And through kind of this intentional effort that we made to conduct some research and gather insights around the underlying factors that were contributing to mental health challenges among core members, we really learned a lot about the impact that workplace culture, policies and practices have on AmeriCorps member mental health, as well as, burnout risk. And we also heard loud and clear from both our AmeriCorps members who are between the ages of 18 to 25, as well as the staff who support them, that they were often just navigating the effects of secondary traumatic stress or compassion fatigue, which is a common just occupational hazard, if you will, for those working in helping roles and supporting people with trauma. And we realized we needed to do a lot more to equip our core members and staff members with the skills and the supports to kind of process what they were feeling and experiencing. So ultimately where we're at now is we are taking steps to build a more supportive culture and environment that has some really foundational trainings and resources that are being made available to core members and staff members that are supporting them to feel empowered to care for themselves and to meaningfully show up for each other in the mental health space as they are, showing up in schools and classrooms and in the lives of students and families.
Sorry, curious to know whether other similar types of organizations, I hate to say like Teach for America, but these other kind of major placement organizations, are they doing some of these same things? Do you find that others in the industry are further ahead, further behind in this kind of internal support to enable that, both their people they're placing, but also the ones who are managing them to function better?
Yeah, I've had a few conversations with staff at TFA who are also working in this space, and there are a lot of commonalities between the challenges that we're seeing in the mental health space for our AmeriCorps members. For Teach for America, it's they're young adults who are serving as first-year teachers. A lot of common challenges, as well as a lot of common opportunities. We've been talking a lot about the importance of like adult social emotional learning, like providing our adults, our AmeriCorps members, our staff members with some of the same skills and supports that we are seeking to share and to kind of help our students cultivate within themselves. Our staff members need that same resilience, that same, kind of skill set and mindset. And so there is a lot of opportunity for meaningful thought partnership in this space, given, what we're collectively learning.
Got it. Okay. Well, it's going to be interesting to see, Nicola, when we get to you about educators, some things there. So thank you. And I'm interested also, Sylvia, like kind of when we get to like some questions about, how is burnout kind of manifesting itself? Like what's happening? What's the support for people like you and other folks who are serving patients in various other roles in hospitals and such? Daisy, I want to turn to you. Your organization, Brio, has a pretty ambitious mission, which is to advance global mental health and well-being through design and collaboration with local leaders and organizations. How do you actually, work towards an ideal of not just helping people survive or overcome and overcoming stigma, and getting treatment, but really kind of flourishing? And I just have to give a shout out here to one of our fellow YANA leaders, Mick Hirsch, who's a Divinity School graduate, and he runs Thrive Gulu, which works on some similar issues in more war traumatized communities in northern Uganda. So there's some interesting work being done around the world. But please, Daisy, tell us about Brio and kind of how you do the work.
Yeah, thanks for having me here. So we start with the premise that we believe every person is created to flourish, but as many have already sort of alluded to, the burdens of violence and injustice fall heavily on the shoulders of marginalized communities. And so there is a vicious cycle between poverty and mental health or mental illness that can keep people vulnerable. So we believe that now is the time to catalyze community-owned models that are contextualized to local culture and accessible to some of these most marginalized communities. And that's how we kind of get started working with local community organizations. So we partner, we train, we create resources, essentially to build a world where marginalized communities lead our collective liberation. So that's how we see this. But in terms of actually defining flourishing, I think a lot of times we think of well-being as I feel really good, I just went on vacation and now I'm back and I have this glow. But really, you know, again, as folks have said, it's about connecting to that meaning and purpose, whether you're doing work that is making an impact, or you're doing work that's just personally meaningful to you, a creative or collective expression of your values. In the particular cases of the folks that we are working with, these are communities that face immense constraints. And first of all, we want to say that we're here to support the belief that meaningful living is possible in these contexts. I think that's really important to say. And so what does that look like? We work with local community organizations precisely because they are already advancing some kind of vision of that. You know, if they're working in education, it's because they believe in children and their future. If they're working in human rights, it's because they believe in justice, and they believe that right things should be done. And so we kind of follow into that and we listen pretty deeply to first the leaders and what motivates them, what kind of vision they have, and sort of like what would it look like if they were to succeed? What kind of community or world are they building? And then we do that kind of listening process with the community as well. You know, if you were to thrive in your community right now, before all the systems are transformed to treat you better, what would it look like for you to live well? Is it being able to love your family, or share with your neighbors, or take advantage of opportunities that are, you know, important to you? What does that look like? And then essentially since we're working on the promotion side of mental health, we help our community organization, our partners, to design programs that are skill building in nature. So we're helping to build internal resources and those enduring capacities that help a person to move forward in this context, and also resources between each other. How do they support each other in this particular challenging context? We leverage culture, ancestral traditions, language that resonates with if they're part of a particular movement, such as human rights. And so that's what makes it accessible. And that's essentially how we connect the flourishing piece to actually programming and also constructs that we can define and evaluate.
Can you give a quick example of like a community you've worked with and kind of what the findings were, what they chose to have implemented?
Sure. So this year, one of our partners based in Quito, Ecuador, the capital of Ecuador in South America, wanted to create a program serving the adolescents that are participating in their program. Many of the adolescents come from families with indigenous ancestry. They experience a lot of marginalization for their identity. They also tend to be migrants from the provinces coming to the city looking for work, better life, and what they typically find is not that. There's frequently a lot of violence coming across sort of drug trafficking activity that's really dangerous for adolescents to be exposed to at a really young age. And so, and COVID just, you know, made it so difficult with loss of livelihood, access to food, shelter, care, et cetera. And so this particular organization wanted to build some kind of process where the adolescents in their community could process what was going on with them. They wanted to work towards some sort of construct of resilience. And they wanted to do it with another activist partner. It was an indigenous group that works on storytelling and art that preserves and speaks to their cultural ancestry in sort of an activist way. So we partnered with both of those organizations and designed a program youth came and participated. They also did it virtually because this was during COVID. It was in April this year, and hardly anybody there was vaccinated. And so is a mix of in-person and virtual, where essentially they practiced Indigenous storytelling practices, and it was integrated with a narrative therapy sort of approach. So helping them to kind of ask themselves, what has happened to me, to my family, in my community, and how do I sort of narrate that as a way of sort of actually rising up and saying, I am coming out of this and I'm going to tell the story from my perspective and own that and connect it to others. And so there were some really fun elements to this, but I'll kind of cut to the chase and say we ended up doing a translated version of the Connor-Davidson Resilience Scale, which has been used all over the world with adolescents. And we did actually see an increase in resilience. It's sort of a self-reported kind of pre-post, very basic evaluation. And so we're seeing that, when you create something that is so kind of local to the culture, feels right to the participants, and is centered on these communities and what matters to them, you get programs that work.
Great, thank you for sharing. I'm sure we'll have some other follow-up questions about that. Nicola, I want to turn to you. You are a current SOM student with several years of teaching and coaching teachers, and now you're working on your own nonprofit that focuses helping them. What is it about educators? And curious to know what kinds of people actually are joining your platform that perhaps differentiates them or makes it easier to gather them and focus on their needs from the general public. And I also have to give a little shout out. There's a recent Yale alum, Israel Tovar, class of 17, who started, co-founded another organization called Dream Teacher Project. He is a dedicated classroom teacher, and he and his sister, I believe, started this organization to support and develop teachers of color and help them become catalysts in building generational wealth, like how to start saving, how to start, and so enable them to continue to being teachers while engaging this. And it's just an interesting, another little way of doing it. So, but tell us a little bit about what you're doing with your project.
Yeah, so thank you, and thanks for having me on this panel. And Allison, just want to like double click on everything that you shared around the City Year Corps members and what they're experiencing. And I think it just really to reemphasize that all educators are in a position where they are holding a lot of emotional space for children and young people who are growing up, learning about the world, experiencing life, spending 8 to 10 hours a day with them. And that takes a toll, right? That has strain. And I think, again, as Allison said, if you are the adult that is holding emotional space for kids, you need to have your own really deep reserve of obviously patience. Any parents in the room probably understand that you just need to be patient, but you need other social emotional skills as well. And I think that we are finding that so many educators are pouring so much into the emotional processing and the support of their students that they have nothing left for themselves. And so our organization came about because of the pandemic, but really this problem existed long before of educators in general are in sort of a high emotionally draining profession without much free time to then carve out for themselves. And I think the same is true of nurses, the same is true of doctors, clinicians, like home health aides is another group that we're learning about a lot. Like nothing, in some ways, educators aren't that different from many other social service sector members of the, general public, as you asked, Rachel. But I think that, I'm particularly focused on educators because there is such a big push right now to tend to the emotional needs of kids. And that work is being asked of teachers. And so how do we really ask them to do that if they don't have the skills or like the time and space and permission to even tend to their own emotional needs? So sort of we're coming on the back of a big wave around like a move towards social emotional learning, or SEL, in the education space, and just sort of the idea of making that a core part of a K-12 curriculum. And our response and our question is sort of, how do teachers really effectively teach SEL if they haven't had the opportunity to build those skills themselves?
So who signs up for the coaching and platform? And
Yeah.
how do you get the word out there? No, that's okay.
Yeah. So our program operates through school partnerships. And so we actually go directly to a school leader who is looking for additional ways to support their educators and hopefully keep more folks on their staff. And then so we have a partnership with the school, and then we go directly to the individual teachers, and they can choose to sign up. So I think that what's really important is that even though the partnership comes from the school leader and the school leader is really bought in and invested, the actual coaching work is still opt-in and is still very much individually held by the educator. So it's closer to a therapeutic intervention in the sense that it's entirely confidential. You know, their boss doesn't know that they're doing it, right? But we still have that investment in the work from the school leadership.
Got it. Okay.
And then in terms of who's signing up, it's a mix. So we have in our current program, I would say that I think it's about 60% are in like their first 6 years of teaching. But then the other 40 have, 7, 8, 9, 10 years of experience, and some even more than that. So we have a real range of educators. And otherwise, the demographics mostly mirror what the profession does at large.
Okay, great. Thank you. Sylvia, I want to kind of turn this back to finish up some of the stuff you were starting to tell us about. I mean, how are some of the mental health stresses being addressed, if at all, for people like you? I mean, and you're a little more senior, but are you seeing differences, or is there support, or is it just like, we have a lot of these, there was a lot of ringing the bell, supporting the frontline heroes, but like, what's happening when the camera's not on and people have to go home or be able to come back? And so what are you kind of sensing, and how are you handling, or how the hospitals or clinics handling that for the staff?
So there's a ton of support, and I can speak for my organization, but I think this is kind of across the board. And yes, the bells and the banging of pots and pans was amazing when it was happening. And yet, the stressors for those people, and I will say I was not kind of frontline inpatient ICU. I was frontline in Chelsea, Massachusetts, which is outpatient. So seeing patients, many of whom are young, strapping young men coming in, hardly able to take a breath. And some of those we had to ship off to the hospital, some of them we could send home. But I think for inpatient providers, there was, for all of us actually, there was this incredible coming together and really having a sense of mission and understanding what we needed to do in a given shift. And, over the period of 3 and 6 months in that acute time in 2020, people got tired. People were putting, for example, there are physician researchers putting their research on hold. Women were impacted differently because a lot of the homeschool and having kids of all ages at home, needing to deal with that and still do your work. Telehealth, was easier for some than others. But I would say now, 18 months on, I actually just attended a Zoom today with senior leadership from my organization talking about resilience and burnout prevention. And we have a Center for Physician Wellbeing. I started an advanced practice provider wellness committee. There's a lot of information gathering, kind of how are you doing using some of the validated tools, the Maslach burnout inventory. Stanford has I think it's a work fulfillment index, just trying to assess like, how are people doing now? And then really being able to make the case to leadership, that it's really important to invest in wellness programs. So the Center for Physician Wellness has coaching, for example, which you can sign up for. It's not a therapist, it's not your physician, it's this different lane where I think, Daisy, you've mentioned the ability to dream. Like if all things aside, what would you like to be doing? How would you like to feel? And really taking that and creating the space. I think the words holding space, I think about a lot, for people to think about what their practice means to them, what their work-life balance means to them, what the stressors of a workday means, and how you can kind of leave it at work and do wellness activities for yourself when you go home. So I would say there's a ton of interest, and it's being amplified and elevated to leadership. I think for those of us on the ground, it's important to keep saying this is really important on a day-to-day basis. I joked with you, Rachel, that today I got to come home early for this because I wanted to be home to do this. But usually I'm sitting there at 7:30 at night, finishing up my documentation and responding to all these messages that come through the portal. And there has to be some moment where you say, it's not acute, it's not urgent, I can deal with it tomorrow. And so that sort of leaving work behind is a skill. So I think there's a skill set involved in that. And I think the coaching piece and the focus on coaching as a strategy. And then I will also say, just so creating community for people who are either buried in their work or who might be working remotely, the community of your work colleagues, and kind of trying to build that, whether it's through rounds or Zooms. We have a buddy program where you can be paired with 1 or 2 employees across the organization just to kind of connect. And it's by Zoom still, check in every so often, which is built off of a military program of battle buddies or something. And that's been a nice way to connect. And then Peloton groups, running groups, ways to get together outside safely. All of those kind of holding each other together and being in community together has been really important.
That's great. And if I can, I want to kind of pick up on that theme, maybe in the sort of coming together around a sense of mission or creating community. And I'll pose this to the other panelists. Have you experienced that, or have you seen it when it's more of a positive response or a way of being proactive and positive rather than having, people tend to like bond and negative and complain about things. So are we seeing, even in these high stress moments or in the work that you guys are all working in, this kind of coming together on a sense of mission? Anyone who wants to start with that?
I mean, I think just there's such an interesting thing going on right now in the teaching profession that, we're kind of constantly walking that dangerous line between coming together around a sense of like shared mission and purpose, and like this crisis hit our system and now we need to respond, and the work is so much harder than anyone anticipated. And then you can tilt into a really unhealthy place of like, nothing is right and nothing is possible, and everyone in the system who is not a classroom teacher is out to get me as a teacher, right? And so I think that we are definitely trying to balance that in our communities. And one of the things that we found, though, is when our educators are sitting down with their coach, they are just so happy to have someone to talk to and connect with, because most teachers are pretty, community oriented people. Like they chose this profession because they like being around other humans. And with both Zoom and then the return to reopening schools, but all the COVID precautions, a lot of educators are just struggling to even like have another adult to connect with over the course of the day. Many of them like eat lunch alone in their classrooms because there's no like safe place to take off their mask in the school building, right? Like there's things like that just providing virtual coaching is filling a void for that sense of community and connection. And for us, connection is actually one of our core pillars of well-being that we kind of promote and pursue in coaching, is like, where are you finding pockets and moments of connection throughout your days?
Great. Allison, Daisy. Allison, go ahead.
Yeah, building on what kind of Nicola was sharing, I'll just, add that in the past, I think City Year has often, just advised core members and staff members that when they're exhausted, stressed, feeling burnt out, that they should like lead into self-care, and like by holding self-care bazaars and creating space for self-care, maybe. But in recent years, and particularly over the course of the past, 19, 20 months, we've started to think beyond the commonly embedded notion that the onus is all on us as individuals in order to care for ourselves. And we've kind of drawn from some of the work of activist and writer Nicola Fleischer, who became kind of very well known through this viral Facebook post in which she said that shouting self-care to people who actually need community care is how we fail them. And community care, it's using, our privilege and our resources to show up for the people in our communities, particularly the most vulnerable groups, the most marginalized groups, by, making the time and space to look at each other, connect with each other, say, hey, how are you? Like, how can I be helpful? And like supporting each other in the ways that we each need to be supported versus assuming that, that what works for me will work for, the thousands of other people in the organization that, maybe a leader is supporting. And so, overall, this notion of community care is really gaining traction at City Year, and people are seeing it as a way to kind of come together and like just help each other to kind of care for ourselves while caring for one another, and to support each other in like putting in place and like reinforcing boundaries, when someone's taking time off, or, like instead of making a meeting an hour, making it 50 minutes, 45 minutes, giving folks time to breathe in the midst of our really, really busy days. And I think that the last thing I'll just add is that this concept of community care is also, I think, resonating with folks because there's a strong connection to equity, and like how in order to build a more equitable and inclusive community, we really need to be taking the time to kind of understand the needs in the community and like how we can just meaningfully support each other on the path to fulfilling, a common mission.
Great. Thank you. Daisy.
I love what you all have said about, building resources, not just within each individual, but also between people, because there is more to just two people talking than their individual amounts. It's sort of 1 + 1 = 4 or whatever. But I think an example of how this can look in a lower resource environment where there may not be wellness programs or things that people can be offered through their work is a program that we are working on with an activist community in Mexico. They work with families of disappeared people, people who've lost family members largely to cartel-related violence. What happens typically is these are mothers, their wives, partners, mostly women who will lose a loved one, and then they join a local collective that is both advocating for the local government to address the disappearance of their loved ones, and also they're out looking for to find the person who's gone missing. And so usually they find themselves in places like grave sites. And so it's pretty intense and traumatic. The group we're working with has been in the activist space for a long time. And at some point they recognized, it would be really great for us to come together and actually talk about restoration, talk about what we want in life. And so a lot of their program, it actually is focused on burnout. And there's a strong theme of re-inhabiting your body and taking care of yourself kind of as a holistic human being. And one of the outcomes actually recently was there was an older woman who she lost her husband about 10 years ago. And so she spent the past 10 years actually looking for him, knowing that she was looking for his remains, really. And so she was going kind of all over. And you wouldn't expect this to be a positive outcome, but we really thought it was. After participating in the program, she said, you know what, I think I've realized that I don't want to spend the rest of my life digging in the ground. I actually want to re-engage. I want to love my grandkids and my family. And I think what's really powerful about that is it doesn't necessarily mean that like we don't care about the mission anymore. We don't care about, doing the work or showing up in the way that we have for so long. Sometimes it means I'm going to change the way I look at the work. I'm going to change the way that I involve myself in the mission. Because I've discovered what matters to me and how I want to live. So I think sometimes it's a shift in perspective and sort of saying, here's the new way that I want to engage in life and to sort of face the challenges that I'm facing. And I'm going to do it in this way and be okay with that.
Thank you. I wanted maybe pick up on this idea. I don't know if we talked about stigma of mental health or talking about mental health in either your own personal life experiences or in dealing with the people you deal with. And then over time, Sylvia, you and I have been around for a little longer than some of the other panelists, but, Sylvia, I'll start with you. I mean, if you noticed that there may be a stigma or there's less of, it seems like there's less of one now, everyone's addressing it, but are there still pockets of it where people who probably could benefit from care or aren't getting, we don't know that people need help, what kind of help they need, just around the general concept of stigma about mental health?
I think people are, and again, this is in the post-COVID world, much more open and upfront about it. I was speaking to a nurse practitioner colleague today who does work in a frontline ICU setting, who shared she's been an ICU nurse and nurse practitioner for 15 years, and in the past 2 years has developed an intense anxiety, seeing a therapist on an SSRI and just managing, and kind of said, I would never not do what I do. I love what I do. Someone used the word or the expression mission driven or coming with a calling. And certainly in nursing, that's very much often the case. We love what we do and we realize kind of the burden, and particularly in that situation where she was in the ICU seeing like immense tragedy and death and stressors for that 18-month or, really the 6 months when it was the most acute. So I think there's more of that, of the ability to say to your colleagues, to your boss, I need help. And we have an employee assistance program that's staffed by social workers and psychologists who are just awesome. And I think have been very busy in recent months. So I guess I would say there is less stigma. Generally, it's still hard because you still have to show up every day and do the work. So there's kind of a delicate balance there.
Any sense with maybe patients? I assume that it seems like healthcare providers are asking more questions about other issues related to what's actually being presented to them. Is mental health issues or how someone's feeling or thinking, do you think any change there, or other people who may not want to talk about those things, even if that may be clearly one of the issues that's going on?
Well, I will say my bias, I did a lot of primary care. I did basically 15 years of primary care, and I've circled back into oncology, both of which are settings in which in a patient exam room, you're in this very sacred space where people will open up. And I've always just linked, a lot of physical complaints, particularly if I know a patient well, after assessing whether there might be some physical thing and someone's eating too much acidic food and that's why they have a stomachache all the time, or whether there's, there's always that opening to say, what else is going on that might be causing your symptoms? So I think patients, I think for what I started with, which is there's just an anxiety generally about in the world, whether it's violence or people at risk, communities at risk, or kind of disease and illness and the fear. I think that seems now to pervade all sorts of health issues. So I think
have you seen, has there been an increase in the education of healthcare providers, your experience as nurse practitioners and things you've seen through doctors and other kind of frontline workers to teach how to ask the questions or how to get at the sort of some more awareness of how to get that to be able to help treat those issues for patients?
Absolutely. As well as, there's definitely an increased focus on that. And there's also an increased focus on trying to see red flags for suicidality or substance abuse, or really just leaning into that secondary aspect of mental health distress.
Okay, good. Any other panelists want to talk about kind of issues related to stigma or reluctance to talk about it, and how you've been dealing with or seeing people deal with it? Go ahead, Nicola.
I can share. I think that my general take on this from my work with teachers, and I would imagine that extends like beyond that, is that the stigma continues to persist around mental health and therapy, because it comes with it a sense of like, you know, something is clinically wrong with me. And, you know, whether or not that is necessarily true about the purpose of mental health is neither here nor there. Like, people think that, right? But I think that what we are finding, we're able to like get a wedge in by calling it coaching. And I'm really interested, Sylvia, to hear more about like the coaching that they're doing for physicians as well. You know, by calling it coaching and by saying like, this is just about getting in touch with yourself, making space to feel your emotions. You know, we're not going towards diagnosing anything. We're not going into the sort of medical paradigm around mental health being this sort of like thing that you get right. And more just saying like, what's going on for you? Do you have a space to even think about that? And I think that our society in general, like, has gotten so far from people being in touch with themselves on those things. And we've lost touch with institutions that provide space for us to kind of dig deep and reflect and connect in really emotive ways with other humans. And so I think I'm like a huge believer in coaching. I think coaching and sort of like structured ways to get people to do that work are the thing that's going to kind of get us through and help us as humans, like, get back in touch with ourselves.
Great, thank you. Allison.
Yeah, it's interesting. Just reflecting on what Nicola is sharing, and it resonates, but also just to kind of, you know, build on it. I do think there is a deeply ingrained stigma in our society. A lot of it is internalized, you know, within us, and you know, I do think we've made some great, you know, progress as well during COVID. There has been this collective trauma, even though people have been differently and disproportionately impacted. Something I've seen though, in just within the city or community in terms of how people are talking about mental health, is that they're starting to equate it more like with physical health. Like, it's something we all have. We all have physical health. We all have mental health. We go to see, you know, doctors to help us feel like just healthier physically. And going to therapy, or, you know, going to a mindfulness or meditation space. It's all about helping to optimize our well-being and just like our overall, just state of mind. And so I think that, the collective experience, you know, of the past, you know, 2 years has helped people to just realize that caring for mental health is on the same level as physical health. At the same time, you know, every demographic group experiences mental health differently. I know that, you know, just based on conversations I've had with, you know, our diverse AmeriCorps members across the country, while trying to, you know, build resources or procure resources and build resource hubs for them, that just, you know, members of the BIPOC community will often struggle to find therapists who can relate to them culturally and reflect their identities. And so equitable kind of knowledge and access to resources are vital to kind of breaking down that stigma and helping folks to just feel like these resources, these supports, they are for them. And the last thing I'll just kind of share on this front is that I think that one thing I've also seen help to kind of just chip away at the stigma surrounding mental health and talking about it is just through, you know, people opening up about their own mental health kind of challenges and acknowledging that it's okay not to be okay. Just through modeling kind of that vulnerability is helping others to feel more comfortable kind of doing the same. And that's kind of connected to the concept of community care as well, that we can support others just through modeling and being open kind of about our own experiences and challenges. It can be therapeutic both ways.
That's great. Thank you. Daisy, do you want to share? I don't know are you working exclusively outside of the United States, or you're working with communities in the States? And are there differences in how mental health is approached in various other cultures?
Yeah, absolutely. We currently don't have any partnerships in the United States. We do some training and consulting, but our focus has been largely some of the most marginalized and lowest resource in terms of access to mental health care that's contextualized. My co-founder happens to be a clinical psychologist and is, to Allison's point, a Latino male. And, last we checked, I think it's like they make up about 1.4% of licensed psychologists or something like that. And so the profession itself is lacking in terms of representation, diversity, which can certainly, affect the impact of the care that certain communities are able to get. So it's absolutely a pressing issue. We think about stigma a lot because we're in a lot of contexts where mental health isn't really a phrase that is mentioned, far much less, depression, anxiety, other potential diagnoses. And, most of the time I find myself wondering, is it because we just don't really, as humanity, we don't really want to admit that that we can be, that we're fallible, that we can kind of fall apart at times, and that there's really no cure for being human, as they say, and but we don't like to face that, and so some of the times we're speaking with refugee communities, and these are women, and they sort of use words like they talk about these horrible things they faced, and then they say, but I'm strong, so that's language that's frequently used, like I'm not affected by this, I can't afford to be affected by this, my kids are depending on me, these kinds of narratives. Other times it's just, nothing's wrong, or, in some places, like kids aren't encouraged to express themselves, express their feelings, just sort of don't talk about it. So yes, absolutely. I think there is a challenge there. One of the ways that we try to get around it is to ask better questions. And so, sometimes it's just a question of, tell me about the last time you felt really alive or excited about something. What was that thing? They'll kind of come, most people have some kind of answer to that. Or the flip side of it is, something along the lines of where does it hurt? Which I think is a Ruby Sales sort of civil rights activist question she's talked about in the past, of just rather than saying what's wrong with you, sort of like, can you show me where the pain is? Can you show me where that's coming from? And can you tell me about that experience? What is it like for you? And that's the other thing we say a lot is, what has it been like for you to, do whatever it is that you're doing, or to go through whatever it is you're going through? And sometimes that will open, it'll crack, the light will just kind of shine through the crack, and we'll kind of start to see a little bit of a fuller picture of what a person's experience is. But it is hard to talk about all of this.
Excellent, thank you. Well, before we open up for some questions, kind of want to pose back to any of you to sort of, is there anything we haven't talked about, or something you really would like other people to know about the work you did, about your own experiences, what you see as hopeful in the work you do, in the space you do, in the profession you're in, whatever it may be? Okay, kind of an open question, but we can have a conversation about it. Obviously, we've got mostly medical teachers and a few other things. And, I start thinking, I started as a corporate lawyer, and, there's a whole other field there, high stress levels. You think I have nothing really to complain about, I'm doing well, but, people do have high levels of stress in other professions as well. Right now, we're speaking specifically about kind of the caring communities and the services communities. But I don't know, Sylvia, you've done we're never going to get to all the kind of research and things you've done. You started, these centers and things, but other stuff you've seen with these concepts of burnout and resiliency and on how to keep going. Is there anything else that kind of comes to mind? Any particular stories about somebody really was resilient, or something where it was sort of undiagnosed, or the mental health really just got in the way, and the society, or we could have done a better job?
I can't think of any anecdotes off the top of my head. But I guess I would say I am optimistic and hopeful. I think to have, there are positions now that are becoming more prevalent, such as a chief wellness officer. So you've got CEO, CIO, COO, and there's a physician at Stanford Health, which is a huge academic medical system, not unlike Harvard and MGH where I work, where there's a chief wellness officer who is a physician who's done a lot of work in and research on burnout and resilience. He was an oncologist by training. But I feel like that is very powerful. If leadership of organizations really understands to have a healthy workforce in my setting to deliver quality patient care to our patients, we have to not only take care of our people, but we need to put resources toward that. And I really see that happening more and more. And, you know, the financial support that's absolutely needed to support that work and to support that leadership and research and all that's going to really take to get it, to give it some more momentum and traction.
Excellent. And I hope you can, we like to share resources and sometimes we get questions. So if you have any links or give me the name of the professor and some other research that we can share with the audience, people like to do some deeper dives. Allison, you're nodding your head and you're at another organization. How are you finding this being modeled there? And are you hopeful? Is this going to be kind of institutionalized and it's going to have some effect? One of this kind of positive notes.
Yeah, I am hopeful, and I also believe we have a long ways to go in terms of building really authentic cultures within our workplaces where leaders and staff members really do believe and understand that caring for ourselves and each other is not separate to our work, but that it can and should be and is a part of our work. Like, I think that, there is this tendency to think of like people work and caring for well-being and self-care and mental health and as being just like, work that's just nice to have and yeah, let's invest in it when we can, but like we need to focus on impact and data and, just results and, just what we've been learning, at City Year in recent years, and there's still ways to go to really like build new mindsets around this, but that, self-care, community care, that is a part of our work. Like in order to build a resilient community of AmeriCorps members, of staff members, of alumni, we have tens of thousands of alumni like across the country, building skills around caring for ourselves and each other will help to sustain them in the work that they're doing. Often, they're continuing to work in helping roles. And so I'm optimistic that more attention is being paid to this, to mental health, and that mental health is actually being named. We're not just, saying well-being is equally important. They're related, but different. And I think actually naming mental health is helping to somewhat destigmatize it. But that's just a start. And there's really deeper work that needs to happen around mindsets and kind of the culture and systems and structures and practices that are helping people to really build these new mindsets.
Got it. So Daisy and Nicola, I mean, you're the sort of younger, you're this next generation, you're coming, now you're we're all from relatively elite institution. So you're coming out of SOM into these spaces. How are you, what's your kind of take on this going forward? Daisy, go ahead.
Yeah, I really love what you were saying, Allison, about all of this being a part of our work. I didn't mention this, but we also do a lot of, holding spaces and trainings for social impact leaders in lots of places around the world. And one of the really common things for some reason is that, a lot of us come to this service work with this feeling that we don't need the mission. And that's almost it's almost to exempt ourselves from this, like we want to stand for the flourishing of others and to advance this mission and to advocate for justice. And then all along the way, people are just absolutely, they're getting super tired. They're pushing themselves past the limit. They're treating themselves actually rather poorly while advocating for others to be treated well, And so the irony there, and I'm learning this myself, is really to say, I need this mission as much as everybody else that I'm serving. I'm not exempt from this. And if I'm going to stand for your healing, I have to stand for mine too. And I think it's really hard because we sort of, again, like came from an elite institution, have all the resources. There's all that comparison that can really creep in, especially when you're working with marginalized communities. And so, you want to come back to this sort of, but still I'm human and I need this too. And I want to participate in it.
Good, I like that. Nicola, did you have a kind of closing thought on this from your perspective?
I mean, I think that Daisy, what you were just sharing brought me back to an article, or really a piece of work by an author and activist, Thibaut Kuhn, around white supremacist culture and around how sort of like perfectionism and having one clear right way is such a dominant part of the culture that we're all living in right now. And I think that that does seep into whether it's young people looking, kind of getting at what Daisy was talking about, young people like seeking to kind of burn the candle at both ends to make an impact, and then being unable to kind of accept their own need for care and downtime and sort of the bounds of their own skills. I mean, I've even just like starting a nonprofit and being a student, I have like reached moments of burnout and then said to myself, hold on, I'm building an organization fighting burnout. Like I have to close the computer, and so I think it's like everyday work to kind of be able to look at your own habits and see where you're letting that self-talk or that kind of obsession with perfection and achievement that is so pervasive all around us, control your actions.
That's great. Well, I want to, if anybody in the audience has a quick, chat or a question, but otherwise I hope our panelists will, if anybody has any follow-up questions. But I think this was a really interesting conversation, and I not only praise, and we all praise not only the work that you do, but kind of your reflections on it and for contributing to that. And I hope by having this program, and for a lot of what YANA does is kind of create that sense of community so people don't feel like they're alone, and particularly for those in the nonprofit and social impact space. We may not do specific coaching on these issues, but we know there are experts out there who do it. And that's certainly by creating some space for people to come together and share, be like, oh my gosh, I'm doing the same thing, or I'm really having a hard time too. I'm launching a nonprofit and I'm trying to do this and raise a family. And just to feel like you can stay true to whatever your underlying mission is at the same time of giving yourself some space, like you said, to create community. You guys have all raised some really interesting thoughts. So I just wanted to say thank you from YANA for coming together and coming here and sharing what you do. I hope, wish you all the best of luck and continued work. I hope we can continue to share resources and conversation. Since some of us are in the Northeast, maybe we'll try to get together for lunch or something. Please, I see Sylvia, you shared some resources. So if you come up with anything else, Nicola, you mentioned an article. If there's anything else you think of that might be nice to share, please do it. And happy to, we'll share your links to your organizations. And Sylvia, if there's anything related, it may not be Mass General, but kind of underneath, if there are particular centers you wanted to promote or let us know what's going on, please feel free to share those links and we will send them out with a video after the program. So
I have to say, I'm so excited that we've all mentioned coaching in some way. Like I feel like I'm actually in the process of becoming certified as a coach. And I realized I've been doing it in my primary care practice for 2 decades, but I never knew what to call it until I actually realized that I had physician colleagues who'd gone through training, and I started to learn more about it. And it's just an incredibly powerful space to be. And I think we've all shared different examples of how the coaching mindset, which is very much about appreciative inquiry and being aspirational, is so important in all of these different settings where people really have their nose to the ground, either in work or the challenges and, social inequities or whatever the hardship, big or small, that people face on a day-to-day basis, to have that as just a model for how to help people to move forward and kind of see over the muck and the mire of day to day. So I think there's something there.
Beautiful idea. I think we'll hold on to that as we wound up our program. So thank you again for taking time out of your days and your work. And I hope you all get some rest and continue the good work. And we hope to see you back with a YANA program again in the future. So have a great evening and thanks for sharing. Good night.
Thank you, Rachel.